What's going on, guys? Tony here. So tomorrow I've got a video scheduled to be released. It is a demo version of me using Doxy.me, which is a free level HIPAA compliant telehealth platform. And what I'm doing basically is I am sending a link through text message to my physical therapist assistant, pretending he is a new patient who's looking to schedule an initial evaluation with me. And I'm doing this in a way to demo how simple it could be to transition a person from telephone phone call to HIPAA compliant telehealth evaluation. Because last night in my zero to paid Medicare billing course, we were talking about the new patient admission process. We were reviewing what is actually required in an initial evaluation based on published Medicare guidelines. We were talking about what information we need to collect from the patient. And one of the things that we've always done is we do a telephone admission ahead of time. So when my patient is in my clinic for the first time, or if you're a mobile therapist and you're in the patient's home for the first time, you don't have to waste non-billable time collecting background information. I also believe the first telephone call is a great time to build rapport, to establish trust, to get a sense for what the patient is looking for, make sure that you can deliver the service the patient wants and needs. So the conversation in my zero to paid course last night was, all right, if I'm going to spend 15 or 20 minutes on the phone before the initial evaluation, collecting the case history, collecting the information, building rapport, that would traditionally be non-billable time. So what I would always do in my clinic is I would do that when I had an opening on my schedule. So maybe I had a patient cancel or a no-show. Maybe I just didn't have a booked appointment, sometime in the afternoon, and I would use that time to do telephone admissions for new patients that are scheduled the next day or later that week. But that would typically be non-billable time. Well, in this situation, what we're doing is we're saying, okay, the client is calling. They want to schedule the initial evaluation. We either do it at the point of that first call or when we do a follow-up call, because we tell the client, we're going to go ahead and we'll verify your coverage. We'll let you know if there's any out-of-pocket cost, and we're going to call you back. We choose a time that's most advantageous for our schedule. Now, if you're a mobile therapist, you might do this driving between patient appointments. If you're a brick and mortar clinic, you might do this during a slow time in the clinic or during a lunch break. But the idea is, now what happens is when we return that call, we could potentially send them, and the logistics still need to be worked out, but we could potentially send them a link to a telehealth platform. Now, I know HelloNote, I know Doxy.me, I know there are other HIPAA compliant platforms that allow you to simply send a link. The client doesn't have to download an app, which I love. I hate having to download an app. They simply use the browser on their smartphone, but I send them that link, they click on it, they join me in the telehealth session. And I essentially do my initial evaluation. Now, of course, we have to have consent signs and we have to get some background information. There are therapists that are doing telehealth every single day across the country. So there are systems for that, whether we're doing electronic signatures or we're emailing the documentation ahead of time and getting it signed. There's different ways we can handle that. But my purpose here is to explore new pathways to improve the patient care experience, to improve the profitability of your practice, whether you're a PT, OT, or SLP, and to see what we can actually do within the confines of the regulations to, achieve the goals. Both your goal as a therapist, your goal as a business owner, and the patient's goal as a potential client. I believe that we can convert an individual from a telephone call to a telehealth platform without ever coming into my clinic or me going to their home, completing the initial evaluation at that time, and then the first time we're face-to-face, in person, we can initiate care. So food for thought. I'm just experimenting, guys. I love to figure stuff out and I love to tinker. This is one of those things. So let me know what your thoughts are. I know there's going to be a lot of resistance to this in general. I'll get the logistics worked out. I will share it with my zero to paid cohort. But until then, keep fighting the good fight. Take a look at this video that YouTube is recommending you watch next, and I'll see you guys on my next video.